What's up, guys? So I just wanted to go over why I like to see my patients once a month after they've gone through their initial bout of Schroth Method physical therapy with me and why that is important. Little story for you. I have this patient who is a 13-year-old girl, super awesome, super nice, literally an all-star patient. She knows her Schroth exercises super well. We went through Schroth Method physical therapy together for the first 3 months or so, 2 to 3 times a week, until she really learned her Schroth Method exercises really well. And then after that, we've just been following up with her over the last 1.5 to 2 years, just 1 time per month. And usually they're just normal check-ins. We go over the same exercises that are most effective for her and for her specific spine, just to make sure that her form is on point, she's not doing any compensations, and that she's just keeping up with all of her exercises. So this month, this patient came in last week to see me for her monthly check-in, and she had just gotten an x-ray from the doctor about 2 weeks ago, and so I always ask them to bring in their most recent x-ray because they're usually getting them at least every 6 months if they're still in their peak growing phase, and she is. So her mom brought in a copy of what her x-ray looked like, and I was looking at her x-ray and I was like, something is totally different about this. She wears a brace. She's been doing Schroth exercises for a right-sided thoracic curve for the last 2 years. And I was looking at her x-ray, and it looks like she no longer has a right-sided thoracic curve. She just has a left-sided thoracic curve. So I saw something, and I was like, this is off. We need to check into this. And so I called her doctor, checked in with him to make sure that the x-ray was done properly and from the right view and labeled correctly, and of course it was. And so she went from the last month I saw her to this month, going from a right-sided thoracic curve to a left-sided thoracic curve. So with her brace was pushing on her right thoracic prominence. It actually overcorrected her scoliosis so much that now she has a left-sided thoracic curve, which is kind of crazy. And so it was super important that I was able to catch this on her x-ray, because now, we get rid of the brace because it's pushing her way too much in the opposite direction. And so hopefully by getting rid of the brace and not wearing it, her spine will then correct back towards neutral. And then we're going to alter her Schroth exercises now that she has a left-sided thoracic curve. So that's why check-ins every month are super important.